Hi, I'm Ian Hickie. I'm the co-director of the Brain and Mind Centre here at the University of Sydney, and I'm also a National Mental Health Commissioner. It's my great pleasure to support the awareness campaign for borderline personality disorder, BPD, and particularly to speak to those who are experiencing this condition and their families, and the ways in which we might more positively promote the quality of their lives and also more positive engagement with the health system. This has been one of the most challenging areas of modern mental health practice. People with BPD have frequently been excluded from reasonable care, not provided with real care and compassion, let alone adequate evidence-based treatment. And although they've often presented for care to emergency departments, to clinicians, to other parts of the health system, frequently been turned away, frequently been criticised, frequently been blamed for the problems that they actually present. I think very fortunately we now live in a more enlightened age, and we see real activism by people experiencing this condition, their families, and groups of clinicians who are prepared to support the journey that people with this condition need to undertake, and also to support very appropriately families and carers who are so affected by what is going on in this particular world. The Australian healthcare system has not been a great system in truth for many people with mental health problems, but particularly for those with conditions like BPD who really require ongoing, specialised and sophisticated care on an outpatient basis, not largely in hospitals, largely in outpatient ambulatory care settings. We need to make sure that in the future we see the right responses in the Australian healthcare system, from clinicians, from local state services, for support under the Medicare system, but also in a broad community and particularly multidisciplinary forms of practice that really say we're here to help. Treatments are available. We can improve the quality of life for the person with the condition and provide greater support to their families. It's the time to be making those assertions right now. We have sympathetic governments, but we need to change the way we fund, support, train, and most importantly, provide the types of clinical practice that are likely to make a difference in the longer run. I look forward to seeing a real change in this area. For the last 30 years that I've been in practice, I must say this condition, BPD, has been one of the ones that's been most poorly treated, and where people who've had the condition and their families have been most excluded from reasonable care. I do think we're on the threshold of a significant change. So I welcome the opportunity to be associated with this awareness campaign, and I look forward to seeing the outcomes of this growth in community support.